understand?
Correct.
Or you can change it so that your body can fight it. Because apparently in our bodies we all have the potential for cancer to grow.
Yes.
Question I'd like to ask you, just illustrate again a few of the things when a woman gets diagnosed with breast cancer, a few of the things that a woman really needs to look out for. Because remember, you're not in that extremely emotional place that you were when you first hear the news. And something that's going to be really helpful to anybody listening.
In terms of after you get diagnosed, what you need to look out for, or what you need to pay attention to?
Yeah, how you navigate your way through in terms of your choices afterwards.
Well, I think it's important to make a decision to take a very proactive approach about every aspect of your life as soon as you get diagnosed. And that means, in addition to the medical treatment that you will be receiving, lifestyle changes. Are you getting enough exercise? Are you getting enough sleep? Are you eating clean, meaning
Healthy,
real
food.
correct, unprocessed foods, greens, your vegetables, your fruit, healthy protein, drinking a lot of water, cutting back on your sugar intake, all of those things. And again, you have to do the research so you know what will work for you, what will make sense for you based on your diagnosis. It's important when you are diagnosed, look at the results that you have in front of you.
And you mentioned about different types of cancer.
Correct.
To different women.
Yes.
All right. So name some of those again, the different types of cancer.
You may have invasive ductal carcinoma, you may have ductal carcinoma in situ. Again, you also want to look at the stages of breast cancer. Stage 1, stage 2, stage 3, stage 1A, stage 1B. And everything you see on the paper that you're given and you don't understand in layman's terms, ask your doctor to break it down to you, tell you what it means, give you an explanation. And then you take that result as well, and you do your own research. Go on, you can go, there's a wealth of information online that you can go and just key in the key terms, and you will get an explanation of what these things are. And then you can start deciphering, okay, so if this is what I have, yes, I can see why he will give me, the chemo. And then even once you start your treatment, and they've, you know what drugs you're taking, find out what the side effects are of the drugs. Don't wait for it to happen. Because that's the other thing. Correct. Yeah. Because in a lot of instances, you can make yourself a lot more comfortable while you're taking this chemo, because the different drugs will have different effects. And different people will get treated with different drugs.
Yes, they react differently.
And you have different things. You may have a situation where you may have nausea. In my case, I had the blackening of my hands and dry. My hands were very dry and very.
Explain that. What do you mean?
Once I started taking the chemo, because there was a drug called adriamycin. It's actually nicknamed the Red Devil. And that drug, and I guess different people react differently, as I said earlier. I found that I was fine on day 1 and day 2. On day 3, I would just shut down. I got chronic fatigue, where you just felt like your bones were breaking and you could not move. The hands and your palms were very dark, like as if it was like they were like burnt and dry. So it was important to keep your skin moisturized, and then to eat in a way that you would be able to mitigate the effects of the nausea and the vomiting. I was nauseous. I never vomited during the course of my chemo. There are people who have a really difficult time with chemo because they vomit all the time. I was nauseous, but I never vomited.
Did you lose weight? Did you lose a lot of weight?
Yes. I look like a crackhead, Angie, to be very honest with you. I lost 22 pounds, and I'm not a very heavy person. At my heaviest, I was at 140 pounds, and I was down to 116. And I'm quite tall, so losing 22 pounds at any one time.
And you lost your hair?
Yes, everything. I was skin and bones. But one of the redeeming things, I remember my kids coming to visit me, and I got a wig, not because I wanted to wear a wig. I was quite comfortable with carrying my bald head. And my children said to me, my son said to me, my son is 10 years old now, so he would have been 9 at the time. He says, "Mommy, I think you're beautiful without the wig. He's going to wear the wig.
Well, he's your son, isn't
Yes,
he?
and it was wonderful.
That's
It
beautiful.
was wonderful. So the wig quickly went out the
You
door
didn't need
because
it.
I didn't need it. I got it because they were coming, and then once they said, no, we didn't, we just did away with the wig. And there's something called peripheral neuropathy, that your hands, you get this horrible, awful tingling sensation in your hands and your feet, and people who suffer with diabetes will get that as well. And it's because the chemo has an impact on your nerves.
Yeah,
And one of the things that you could do is to avoid hot and cold temperatures. I have a friend who was going through breast cancer at the time, and I was further along with my treatment than she was. And one of the things, when she felt this burning sensation in her hands and her feet, she would go outside in the snow, thinking that that would give her relief, and she was making it even worse, because you're supposed to avoid extreme temperatures when you have, because it's not a physical thing, it's actually your nerves. So the extreme temperatures will cause the nerves to react further and exacerbate the problem. And so I also found staying off my feet once it was on would help a lot, because once you put the pressure on your feet, it gets worse. So again, you have to educate yourself in stages. Educate yourself at diagnosis. Educate yourself at the course of treatment. What does it mean? What can I expect? People get mouth sores from going through chemo.
You didn't, did you?
No,
No.
because from my research I was able to determine that if you avoid extremely hot food and eat your food warm or lukewarm, you lessen the likelihood of getting mouth sores. If you use a non-alcoholic mouthwash, you lessen the likelihood.
So don't use your Listerine.
Correct. Don't use your Listerine. Use something that has no alcohol.
Yeah.
Get a very soft toothbrush to brush your teeth. Do not eat hot foods. I never got any mouth sores.
But let me ask you something, all right? As I said before, the doctors have many women coming in, having to diagnose them, going through this. They're not giving this type of information. It gets me angry.
Yeah.
No, it does, because I feel that women need to be informed. If they knew, then even for their families, even for those of us who are caring for people who are going through this, it would make the job easier.
And it would make the cancer journey a lot easier, because just there are things that you cannot avoid. Chemo will make you feel sick. You will feel really horrible. You will feel really down. But something like the external effects, for example, the mouth sores and stuff, if there are things that can be done to avoid it or to lessen, why not give people that information so that they can try to help themselves?
Well, I have to say that we have to be thankful for the power of social media, the internet, because nowadays we didn't have that 20 years ago. Now we can source the information. And one of the key things that you keep coming up with is navigate your illness, navigate it, all right? So you kind of map it, research it. But would you advise, if somebody has the option of traveling abroad, if they've just had this diagnosis, would you advise them to go abroad or not? I send you a tough question, right? Because every cancer patient is different. What do you think?
If you have the means and the resources, I would say go. For the simple fact that we cannot run away from the fact that in a more metropolitan country, there is access to a lot more help, a lot more expertise, and the information is a lot more forthcoming. I don't want to make somebody who is not able to access that care outside of St. Lucia, saying that there's no hope for them here. Maybe what I should say is that it may be a little bit easier. It may be a little bit easier of a process to deal with if you are able to go away, because you will have access to more care, you have more options. And that's the best way I can say it, Angie. I'm happy that I got to go away, because I was able to learn more about the disease that I have. I was able to learn more about my diagnosis. I was able to have further testing, which helped me to feel that I was given the best possible chance. I was given the best possible course of treatment, because I was taken from point A to Z
Yeah,
in
not
terms
only
of the
that.
the completion of the diagnosis.
And not only that, the complete diagnosis.
Correct.
All right. And so therefore, it's not about saying that we can't get treatment here. But I think if people are aware, especially by listening to your story and your journey, maybe we can advocate to make sure that we get more here.
Correct.
That's what we